The format of this debate will proceed as follows. A brief introduction on drug testing in pregnancy will be discussed by Amy Sandifer. Following the brief introduction, Latoya Gibson will identify the ethical principles in conflict. Once those principles are identified, each party will debate the deontological and utilitarian stance on the dilemma. Upon conclusion of this debate, a potential resolution will be identified utilizing Josephson's Institute of Ethics 5 Steps of Principle Reasoning. Amy Sandifer, you may now begin with the introduction.
Drug testing during pregnancy is a controversial topic healthcare professionals and lawmakers have debated for years. There is an urgency for lawmakers and healthcare professionals to find a common ground regarding mandated drug testing during pregnancy and put a policy into effect to create a solution. A 2010 study revealed that 7.4% of pregnant women ages 18 to 21 participated in illicit drug use at some time during their pregnancy. According to Goodman and Wolf, prenatal substance abuse accounts for an increased risk in both maternal and fetal morbidity and mortality. The pregnant woman can be at risk for life-threatening issues such as placental abruption, while the infant can be at risk for life-threatening issues such as neonatal withdrawal syndrome. There are fragmented areas of national legislation to address issues of mandated maternal drug testing during pregnancy and consequences of prenatal drug use. However, currently the laws are not consistent from state to state. According to the Guttmacher Institute, 18 states require healthcare professionals to report suspected drug abuse, and 4 states require them to test prenatal drug exposure if abuse is suspected. Currently, Louisiana is not one of the 4 states that requires testing for prenatal drug exposure. The Guttmacher Institute explains that 19 states either created or have funded drug treatment programs specifically targeted to the pregnant woman, and 12 provide pregnant women with priority access to state-funded drug treatment programs. Louisiana is one of the 19 states that provides drug treatment programs specifically targeted to pregnant women. Currently in the state of Louisiana, there are no laws mandating drug testing in pregnancy. However, the topic of interest is current due to a proposed amendment recently introduced into the Louisiana House of Representatives. This is an amendment to House Bill 73. Louisiana House Bill 73 defines the crime of second-degree cruelty to juveniles, and it defines the law as an intentional or criminally negligent mistreatment or neglect by anyone over the age of 17 to any child under the age of 17, which causes serious bodily injury or neurological impairment. Penalties consist of imprisonment at hard labor, but for no more than 40 years. An amendment to House Bill 73 has been proposed by Representative Jerome D. Richard to include second-degree cruelty to a juvenile to include prenatal exposure to drugs. The proposed law retains present law and adds that the crime shall include the intentionally or criminally negligent prenatal exposure of an unborn child to controlled dangerous substances, which results in observable and harmful effects to the physical appearance or functioning, or the presence of controlled dangerous substances found in a newborn that is not the result of medical treatment. The bill is requesting that crimes against juveniles should include prenatal drug exposure, and pregnant women abusing drugs should be prosecuted in a manner as any person intentionally harming a juvenile. The current status of the bill as today is pending in the House of Criminal Justice. The issue of mandatory drug testing during pregnancy has been debated since the 1980s. However, no policy has been placed into effect. The debate today will discuss mandatory drug testing in women. We will also debate whether it's right or wrong, or does the ends justify the means. The ethical principles violated will also be discussed, and those include non-malfeasance and autonomy. And now we'll introduce Latoya Gibson, who will discuss the potential ethical principles violated when considering mandatory drug testing with pregnancy.
Ethical principles are utilized to guide one's analysis of a moral issue or ethical dilemma. Ethical principles are derived from an individual's idea of what is acceptable to society and one's viewpoint or opinion regarding moral activity. The most commonly discussed principles of ethics include beneficence, non-malfeasance, justice, and autonomy. As it relates to the issue of mandated prenatal drug screening, the ethical principles most in conflict include non-malfeasance and autonomy. The ethical principle of non-malfeasance focuses on the premise of not doing harm to an individual or group of people. The duty of no harm must involve an act or actions that are not considered harmful, has the purpose of providing a positive outcome, and the good produced by the act outweighs any evil that is performed. The principle of autonomy maintains respect for all individuals and their ability to freely make their own decision, and it's not based on coercion. The basis of informed consent and full disclosure are based on the principle of autonomy. Autonomy guarantees an individual's freedom and right to choose. In the case of mandated prenatal drug screening, maternal-fetal conflict becomes the underlying issue. The ethical principle of non-malfeasance is challenged as one feels an intrinsic right to protect the fetus based on the known effects of drug use in utero. In contrast, although the use of illegal drugs itself is not a moral act by the mother, the right of the mother to make her own decisions are violated with mandatory drug screening requirements. Amy Sandifer will now present the deontological view of mandated prenatal drug screening.
Deontology. I will be presenting the aspect of deontology as it relates to mandated drug testing during pregnancy. Deontology is a theoretical framework based on a sense of moral obligation or duty. Deontology states that an action's moral rightness or wrongness depends on the action itself and the motivation behind the action. The deontology framework was originally proposed by Immanuel Kant in 1788, and it is a theoretical framework that is based on moral obligation. The principles of deontology are morally driven, meaning that as humans, we are morally obligated to act regardless of the outcomes. The guidance is morality. The duty to do what is right is morally right despite the outcomes, and we have a duty to perform good moral acts. So what is the deontological aspect or stance on maternal drug testing in pregnancy? Well, there's several aspects that come into play here. The first is a maternal fetal entity, or the health and well-being of both the mother and the fetus. And the second would be a healthcare and financial aspect. If one argues that mandating drug testing in pregnancy is too expensive, or if you drug test everyone when they walk in the door for their first prenatal visit, I just have a question for you. If a simple test could diagnose an illness, what would be the reason not to perform the test? Is cost a good reason? Well, drug addiction or drug use can be similar to any type of illness or mental illness, and drug addiction is considered an illness or a disease. The DSM-4 defines substance abuse or drug abuse as a maladaptive behavioral pattern of substance abuse leading to a clinically significant impairment. So therefore, you could say if a mother does have a drug addiction, which could be classified as an illness, and we have a test that can actually diagnose that illness, why would you withhold a testing that could identify an illness early and therefore provide early treatment? And I would like to pose the same question. If a woman had an abnormal breast lump and she went to a healthcare provider, would a healthcare provider withhold a mammogram knowing that breast lump could be cancerous or abnormal just because a mammogram was too expensive, which it could potentially diagnose a treatable illness? Well, if a simple urine drug screen could potentially lead to a diagnosis of a maternal illness, such as a mental illness, such as substance abuse, thereby leading to a prompt treatment, what would be the reason not to do the drug testing? When discussing the fetal aspect of it, or the unborn child, my question is, the fetus is a voiceless victim. So if you have an infant who is in utero and whose mother is abusing drugs, how can that infant speak for itself? I mean, who is the voice of that victim? Why is it fair that an unborn infant is a product of a mother's risky behavior and choices when one simple drug test at the beginning of pregnancy could diagnose that mother abusing drugs, thereby leading to treatment for the drug addiction? When does the fetus have rights? At what point does the fetus have rights? Is it at conception? Is it at viability? Or is it at birth? Who speaks for the fetus? Who stands up for the fetus? From the healthcare and financial aspect, yes, drug testing each individual patient can be expensive, may seem cost or time consuming, but is the price of a drug screen less than the price of treating a newborn infant for a drug withdrawal? The answer is no. A drug screen can cost approximately $40 per screen. Treating one infant for a drug withdrawal can be approximately $50,000 for a hospital stay. What is the deontological stance regarding mandated drug testing in pregnancy? The question is, where does the moral obligation lie? Why should an innocent infant postnatally suffer when a simple drug screen could be performed on a mother, leading to early treatment? Or why should a pregnant woman suffer the effects of an illness that a simple drug screen could detect early, promoting early intervention and treatment? The moral obligation lies to protect both the mother and the infant, and both can be protected with mandated drug testing. Testing every patient during pregnancy will provide early identification of the drug-abusing mother for the purpose of early intervention and early treatment, not for the purpose of prosecution. Early treatment will offer the best maternal and fetal outcomes. The financial burden to society of costly drug screens does not matter. Human life outweighs financial obligation.
The utilitarian framework of ethics determines how right or wrong an action is based solely on its consequences. This theory states that the most ethical action produces the greatest good for the largest amount of individuals and does not focus on what action has been performed, but rather the impact of that action. Jeremy Bentham, the original founder of utilitarianism, states that man is ruled by two entities, pleasure and pain. Actions are considered morally right if they cause pleasure, or happiness and deemed wrong if they produce pain. According to this view, one's actions should be based on producing overall happiness. Utilitarianism is agent neutral, meaning that one's happiness does not overshadow another's. So, who is exactly affected by the issue of mandatory prenatal screening, and what are the consequences? Well, those who are affected include the mother, the fetus, healthcare providers, individual states, as well as healthcare institutions. I will now present the consequences of each of those affected, both positive and negative, by mandatory prenatal drug screening. Maternal effects. So there are positive effects of mandatory prenatal drug screening. One positive effect is the early identification of pregnant drug users. This information may lead to the mother receiving treatment for substance abuse early in her pregnancy. Early identification and treatment may lead to improved health of the mother, which in turn improves the health of the baby and may improve postpartum functioning of the mother as well. Unfortunately, the remaining consequences of mandated prenatal drug screening are considered negative outcomes. There is restriction of the reproductive autonomy of the mother. This means that the woman's privacy and her ability to make reproductive decisions has been limited. There may be an adverse impact on the mother's utilization of prenatal care services. If a mother feels coerced into drug screening, she may not be as likely to seek prenatal care, especially if she's actively involved in substance abuse. The mother may face punitive actions as a result of a positive drug screen. Punitive actions vary among states and include incarceration, removal of the infant after delivery, and even forced delivery. Women may fear seeking treatment for substance abuse during pregnancy, also due to the possibility of repercussions as mentioned previously. Mothers may be required to plead guilty to child neglect in a family drug treatment court, which relinquishes her right to defense and also places her future reputation for employment and housing at risk. Women may be more likely to utilize abortion services instead of obtaining a positive drug screen based on the punitive actions that may occur. The use of public programs, such as Medicaid, may be jeopardized because of a positive screen, which limits a woman's access to health care. In many instances, patients are required to enter into an inpatient drug treatment program. If the mother serves as head of household and is responsible for providing the necessary resources of the home, this inpatient treatment and its expenses may interfere with these duties. There has been some disagreement on the treatment of mother while she's pregnant for substance abuse. While detox is an optimal choice, this is not the ideal form of treatment during pregnancy. This leads to the woman being faced with an inappropriate form of treatment during the pregnancy for the substance abuse itself. Mothers may be required to receive mandatory contraception following delivery and may even face punishment for future pregnancies. And also, very few treatment programs give priority to pregnant mothers, which may delay access to treatment. What are the effects on the fetus of mandatory prenatal drug screening? Early identification and treatment helps to maximize the quality of health and life of the baby. The mother's ability to care for her child is improved after treatment has been sought. According to the state, the fetal rights may actually trump those of the mothers, meaning that the unborn fetus's life and well-being is valued more than the mother's. A lack of prenatal care may produce detrimental effects on the health of the fetus, and removal from the care of the mother may also present effects on an infant, such as their entry into the foster care system. Healthcare providers are also affected by mandatory prenatal drug screening. Healthcare providers are now posed with a higher duty to report a mother who has a positive screen. This mandatory involvement in law enforcement expands the scope of the healthcare provider's involvement in the criminal justice system. The manner in which the clinician works with the pregnant substance abuser may be unfairly biased based on a positive result. The patient-physician relationship may be undermined by mandatory prenatal drug screening. This eliminates the trust that patients may have had once in their healthcare provider and ultimately the quality of healthcare provided. There is conflict between the duty to their patient versus that of the welfare of the mental health providers may be conflicted regarding mandatory reporting based on the possibility of prosecution of the mother. Prosecution of the mother does not improve mental health status, and in addition, the mental health provider may be prosecuted for negligence due to failure to report. Individual states may also be affected by mandatory prenatal drug screening. Consequences to the states include people may be hesitant to move into a state or may actually move away from the state based on the state's values of importance of fetal rights over that of the mothers. And also states are affected by a reduction in the use of public health services by mothers who are deterred to seek prenatal care. Lastly, healthcare institutions may be affected by mandatory prenatal drug screening. The cost of a urine drug screen, as said before, is approximately $40 per screen. Although the test itself does not present a significant impact on healthcare institutions, and in many instances, confirmation with expensive assays is required. There is currently questionable accuracy of testing. Some of the testing is not highly sensitive and may lead to false positive or negative results. Also, the test may be skewed based on methods used by the patients to alter the results of the test. Urine drug screening lacks the ability to determine chronic use versus intermittent use of drugs, and it may not include drugs commonly used in a particular community. Lastly, according to some sources, patient self-report yields more information than urine drug screening does. So, based on the framework of utilitarianism, an act is conceived as ethical based on its producing the greatest good for the greatest number of people. Those affected by mandatory prenatal drug screening include the pregnant mother, the fetus, healthcare providers, the individual states, and also healthcare institutions. Although mandatory screening may provide for early detection and treatment of substance abuse during pregnancy, which has the potential to improve the health and quality of life of both the mother and the fetus, many of the consequences of screening are considered negative. The fear or the act of prosecution by the mother serves as a significant source of strain not only on the woman but also on the healthcare provider. This possibility of punitive action unfortunately leads to a chain of events that could adversely affect each entity in this dilemma. Based on that fear, mothers are more likely to not seek healthcare treatment for prenatal care. They're also less likely to seek treatment regarding substance abuse for fear of prosecution. And also, in addition, the states may be adversely or negatively affected by lack of use of resources. Healthcare providers are placed into a role that they're not comfortable with. They're required to become more involved in the criminal justice system. And this may taint the relationship of the patient and the provider. The patient may not feel like they can disclose as much information to their healthcare provider based on fear. So, in consideration of all of the above consequences that have been mentioned, mandatory prenatal drug screening is not considered a moral act based on the theoretical framework of utilitarianism. Did I say that?
So Latoya, from a utilitarian standpoint, do you feel like mandated drug testing just violates a woman's right to her autonomy?
Absolutely, mandated drug screening will violate a woman's right to their autonomy. Even though, again, utilizing drugs during pregnancy is not considered a moral act, the woman's right to choose has been limited. And so this woman feels coerced, or she feels influenced to not utilize drugs based on the fear of a positive drug screen that she would receive at her doctor's office.
I mean, I understand that, but I mean, who's there to fight for the baby? Who speaks for the infant? I know the mom has the right to autonomy, but at what point does a pregnant woman have the same autonomy as a non-pregnant woman does?
Well, I think just from the standpoint that I'm viewing this issue from the utilitarianism standpoint, you have to look at what produces the most good for the most number of people. While the fetus absolutely can gain benefits from that, unfortunately there are harmful benefits to the mother, as well as healthcare institutions, the states, and even healthcare providers. So based on that, I don't consider mandated prenatal drug screening a moral act. So Amy, how do you feel mandatory prenatal drug screening violates the principle of non-malfeasance, or do you feel like it's violated?
Well, I feel like the definition of non-malfeasance, the ethical principles of non-malfeasance is to do no harm. And my stance is, or the deontological standpoint would be, the baby needs to be protected as well as the mother. So I feel like that mandatory drug testing does not violate non-malfeasance, because even though we are requesting that a mother be tested, it is to do good for both the mother and the fetus. It's to identify and to treat, but also to protect a fetus, an unborn fetus who can't speak for themselves.
So Amy, you feel that every pregnant mother should be screened for drugs or the use of drugs during pregnancy, while on the other hand, I feel that they should not. Do you feel like we could come up with a resolution on this issue?
I think we can.
Okay.
So obviously, Latoya and I have some disagreement on our stance on mandated drug testing. So in order to come to a resolution, we applied the ethical decision-making process using the 5 principal steps of the Josephson Institute of Ethics. So we went through this and we pulled out the positives and the negatives to come into a resolution for us both that we're both happy with.
Step 1 is called clarification. Determine what must be decided. So the issue that's in conflict today is, should mandated prenatal drug screening be required during pregnancy?
We're going to cut
Next,
this out.
we were to formulate a full range of alternative options for mandated drug screening during pregnancy. And those alternatives include reliance on self-report by the patient, no routine drug screening is to be performed, drug screening performed only if suspected by the healthcare provider, routine drug testing for every single mother, or to provide drug screening with informed consent only. So your next C is to eliminate
I
any
don't.
alternatives
She
that
loves
have
Panera.
unethical actions.
I
And
do.
based
It's
on
just
the
too much
alternatives that were
sometimes.
presented,
I agree.
the
It's-
most unethical action would be where you don't provide any drug screening during pregnancy at all. That could result in negligence to the healthcare provider themselves.
But
The next
That
step
was
of
good. Hold on, just
clarification is to
wait. I just
prioritize
wanna be able to
decisions
cut it
based
in.
on the most to the least
Okay.
ethical decision.
Maybe you're like.
So from most to least ethical, drug screening with consent. Next is drug testing to be performed if suspected. The next would be routine drug screening for every mother. Or lastly, reliance on self-report for drug screening.
Once we considered all the
You can move and stuff.
alternatives
It's-
to
like, I mean, you personally.
and to
can move it.
mandated drug testing, we
And
moved
then
on
you
to
can
the
skip it.
evaluation phase. And what we did during our evaluation phase was we considered all decisions in terms of practicality, and with, depending on ethics, the benefits, the burdens, and the risks to individuals. So we looked at the practicality and the expense of drug testing every woman versus not drug testing any woman, or drug treatment programs, the price of drug treatment programs versus the price of an infant staying in the NICU for a stay due to neonatal withdrawal syndrome. So we weighed all those pros and cons, we did checks and balances in order to kind of narrow down our alternatives to a resolution.
Step 3 of Josephson's model includes making the
Previously
decision.
bought this old
So,
couch.
based
Oh,
on
did she tell
the
you this
agreement
story?
between the
No.
both
Okay, well,
parties, we
finish the-
decided to perform drug screening for pregnant patients only with consent. So this provides the patient autonomy. You attempt to maintain all ethical principles for both the mother and the unborn fetus. And you also provide justice and fairness to the mother, protection of the mother against prosecution, and of the infant to foster a healthy and productive life.
They're fantastic pictures I have to show you.
I
So
made this
you're to
flower
consider
for
the
them.
following questions along
You'd
with
be
your decision.
impressed. I mean, I was
Are you
impressed with
treating others as
myself.
you would want to be treated? Would you be comfortable if your reasoning and decision were to be made public? And would you be comfortable if your children were observing your behavior? And based on the decision that we've come to require informed consent during pregnancy for drug screening, the answer to all 3 of these questions is yes.
Pictures for you. But these pictures were so beautiful.
So step 4
Yes.
is
I
to
mean, these girls-
implement
This one girl
the
posted on
decision.
Facebook today. I'm
So
obsessed with it all the time.
we're supposed to develop a plan to implement our decision that we have agreed upon, which is not mandated drug testing, but drug testing with consent, and to maximize the benefits while reducing the cost. So what we have agreed upon is that we are going to develop a plan to institute our decision by developing a consent that includes both an acceptance or a declination statement. In the event of if a patient does agree to a drug test, in the event of a positive drug testing, we will provide the appropriate referral services to protect both the mother and the fetus, because the goal of the testing and the decision is to identify and treat. Because if we provide long-term treatment, if we provide initial treatment for the mother, that will help her for a whole lifetime, but it will also create a safe environment in utero for the infant. We will discuss the pros and cons of drug testing with the patient, and we will help her understand that early identification and treatment provides the best outcome for both herself and the infant.
Said, if you're doing
Maximize
big
benefits
money.
while
I'm
reducing the
excited.
cost.
And I mean, and that
Like
doesn't
we
take
both
as much.
said earlier, a drug screen costs approximately $40 per drug screen. Well, that can be cost consuming when you're testing every pregnant patient. However, if you do provide a $40 screen and you identify a patient early, that can actually be much more inexpensive than dealing with a postnatal hospital stay for an affected infant. Also, drug treatment programs, just through the information we have discovered, a drug treatment program costs approximately $4,700 per hospital stay or per treatment stay. So that once again is cheaper than, or much more cost effective than dealing with an infant who is suffering from
Yeah, well, I mean, and
postnatal,
it takes up your weekends, and
neonatal
it takes
withdrawal
up your
syndrome.
week too, because
The
you're
editing.
editing. But I mean, you can flexible.
But
Like,
step 5 includes modifying and monitoring your decision. So in order to evaluate and adjust the plan to new information, you must stay current on the new research as well as changes in state legislation. Also, you modify your decision based on this information. So modify the effects of the decision and revise the plan of action on new information. So if the state laws were to change, if there were different requirements, or if research finds that early identification and treatment of substance abuse during pregnancy does no benefit to either the mother or the fetus, or you find that it does, you modify that decision based on those things.
So what is our resolution? Our resolution that we both agree on is drug testing with consent. We're going to provide our patients with information and education regarding the
it's going to
dangers
be
of
as much work
substance
as a
abuse.
job, but I'm saying
We're
I
going to
can
offer
get
drug
It's just not
testing
do
structured
something.
hours,
Right,
yeah.
and I
We're going
like.
to discuss the benefits of early detection, early treatment, early intervention. And lastly, we're going to implement a plan for a positive screen, which those include state explaining informational state funded programs and treatment programs specifically for the pregnant woman. So with that being said, I think we both agree on a resolution, and thank you for the great debate. We
Thank you
enjoyed
very much.
debating, we enjoyed learning about the principles, and thank you for listening to our presentation.